So I wanted to start answering some questions on what we need to do for our team to implement anything that needs to be implemented for the COVID-19. So the first thing is, if you'll go to the next slide, Dr. Rob, the first thing is the top 5 crisis response for your office. And so what Lyra recommended yesterday is that we set up a response team to monitor the situation. It could be yourself, it could be your office manager, it could be your operations manager, but somebody in the office needs to be responsible to manage and monitor the situation. We need to make sure that we're getting up-to-date information. She suggested maybe 10 a.m. in the morning and 5 p.m. in the afternoon. You're watching the news, you're monitoring, you're listening to your governor, you're listening to your president, because there are a lot of moving parts here and it's moving really, really fast. We know that there are different laws. There's local law, there's state law, and there's federal law. We're not sure what we should be following. What she did suggest is that you follow the most restrictive law. So if your local law says stay at home, but the federal law says you don't have to, you need to stay at home. So definitely make sure you're monitoring your law, local, state, and federal, and that you have something set up to relay that to your team. It's important that you put together a COVID-19 response policy, and what that means is this is what we're going to do to help our patients. This is how we're going to treat our patients. Are we only treating emergency patients? How are we protecting our patients and our team members? Are we taking temperature when they walk in the door? Are we requiring them to wash their hands? Are we not allowing people in our reception room to sit and wait on our patients? Are we having them rinse with chlorhexidine? Whatever your policy is, put it together as a COVID-19 response policy. And then also, what's the policy for the team members? Who's allowed to come in? What's their rate of pay when they come in? Also, how are they going to be protected? How do you expect them to be protected? Are you taking their temperature when they walk in the office? What type of protective clothing are they wearing? And what do you expect of them when they get home? So write all this in the response policy and then communicate with your employees on a regular basis. If you're not open in your office, which I'm sure many of you are not, and you're only seeing emergency patients or you're not seeing any patients at all, you still need to be in contact with your team members because they still need to know what is going on in my office. So maybe you have a Zoom call with them, maybe you have FaceTime calls with them, maybe you reach out to them one-on-one, but please communicate with your employees, even if it's an email, WhatsApp app, or GroupMe. And then enforce practices to combat the spread of COVID-19, meaning encourage your team members to stay at home. Encourage them not to socialize with friends or other team members. If a team member is socializing with other friends, maybe part of your policy is they're not allowed to come to work, which is one of the things that I implemented. I said, if you have contact with anybody outside your family, outside of your home, the people who live with you, you are not to come in and help me with an emergency. Absolutely not. And I do have team members who still want to see friends, and that's their right, but I'm encouraging them not to do that, but they are not allowed in the office at any time, whether we are here or not here. So make sure that you write a policy. The big question, go ahead, is, yes, what's coming up on April 2nd, guys? What's coming up with this federal emergency sick leave? And so this is a policy that goes into effect on April 2nd. It's for full-time employees and part-time employees. It applies to anybody who's worked with you, regardless of when you hired them, as long as they're still employed with you on April 2nd. So if you hired them on April 1st, they are still qualified for this leave. It's for employees who have to leave the office for the following reasons. If they get quarantined due to someone in their house being sick, they are entitled to this emergency sick leave pay from you, not from the government. If they're advised to stay at home by their health care provider to be quarantined, they qualify. If they have symptoms and they are seeking a medical diagnosis, whether they're getting tested or not, because we do know tests are a little bit hard to come by in some states. If they're seeking medical diagnosis and they're at home during this time, they qualify for you to have to pay them. And if they have to take care of a family member with these symptoms, they qualify for this pay from you.
Okay, so we have a question that said, so the dental office, which these people are working for, would have to pay, according to this new law that's coming up on the 2nd, they'd have to pay under these circumstances that you just summarized from yesterday's meeting.
Yes.
Okay.
Yes. So it's your responsibility as an employer to pay them if they have to stay at home to get sick. So how much are you required to pay them? Go ahead, Dr. Rob. Forward.
Oh, sorry.
Pay attention.
I'm reading the chats. That's my job today, is to read the chats
and forward the slides.
And I'm a guy, so we can't do two things at once. So here we go.
So what if you get shut down or shelter in place is dictated by the governor? Does this still qualify? Currently, we do not know, but the attorneys feel like that this is going to be a qualifying factor for this emergency sick care that you would have to pay your employees during this time that you're shut down. What does that mean for you? Currently, it's dictated that it's $511 per day that you would have to pay a full-time employee, or prorated for a part-time employee up to 10 days or 80 hours for full-time. So that could be as much as $5,110 per full-time employee that you would have to pay if you had these employees employed come April 2nd and they went out on sick leave, or you had to close your office for some reason. It is still unclear. Some regulations are still unclear. And the reason that they put this policy in place for April 2nd and not today is that they're still coming up with new regulations. So we know things are changing daily. So it is so important that you do get professional advice about this and learn what's changing daily, because we don't know if we fired our whole team today, will we still be liable on April 2nd? It's currently thought that you would not be liable, but we just don't know. So the other question that came up is, are there any exemptions for smaller offices? If you have less than 15 employees, if you have less than 50 employees, are you exempt? Currently, the answer is no. Again, this is changing daily, so we just don't know. But what we do know is that an employer can remove a healthcare provider or a high income provider from this qualification. And what does that mean? Can you move those questions, please? That means anybody who's licensed and boarded by the state, they are a high.
Too far?
Yep, go back one.
This one?
Right there, stay. They are a high income producer, and that means your associates also. So you could exempt your associates from this, and your associates would not get this emergency pay. We also know that you can be exempt if you show a financial distress, meaning that if you followed this guideline by the government and you had to pay your employees, would it create financial stress in such a way that you may go out of business? And the government has said, if that's the case, you could be exempt. We don't know what it means to be exempt, of how you can qualify for that. What we do know is that you will have to show some cash flow reports, and you will have to show some expense reports, and they will make a determination if this is a financial distress for you and if you qualify to be exempt from this. So currently we don't have any guidelines on what that means. Okay, next.
Okay, Dr. Bobbi, there's a question. The $511 a day on the previous slide, if I back up one slide, was that the maximum amount that the government is currently requesting of us?
Maximum amount currently is $511 per day, up to 10 days for a full-time employee, up to 80 hours.
So what it looks like, roughly $5,000 for every full-time employee might be something we have to look at.
And that answer is currently. They can extend that. They can say that you're responsible for more. So currently we just don't know. We don't have real guidelines, because again, they're developing this between now and April 2nd. So we'll know more come April 2nd, but currently we're responsible for $511 up to 10 days. Next.
Okay. Guys, feel free to use your the chat window and the question and answer window. To access those, if you're new to the Zoom product, if you scroll to the bottom of the Zoom window, it will actually bring up the chat or the question and answer window.
So another question that came up yesterday and that is being asked is, what are the rights of the associates? Well, again, this is a state-by-state basis. Will they get unemployment? Will they not? Most states, a W-2 employee will get unemployment. So most states will give unemployment to any W-2 employee. A lot of states will not give unemployment to a 1099 or independent contractor. But again, this is state-by-state basis. And the other thing is the government is making exceptions for certain people with unemployment for this pandemic. So we know that things are changing according to the unemployment laws because of the pandemic. The federal government is making some exceptions. So please check with your state on their unemployment rules and their laws to see if you qualify, if you are an associate, and see how much unemployment that you do get. Every state is different as to the amount.
Dr. Bob, we have a question. So as a strategy, if a dentist was to terminate all of their employees prior to the April 2nd deadline, as it stands right now, it looks like they would not be liable for that $5,000?
That is correct. Currently, the way the law stands and from what we know, if we terminate our employees before April 2nd, you will not be responsible to pay that, because what that means is that you have legally closed your office. You don't employ anybody, so you can't give benefits to somebody that you don't employ. That's how it currently stands. We don't know if the government's going to retroact that and say, for instance, maybe it qualifies for people who have worked for you in the last 30 days. We don't know. Currently, they have not implemented that. So as it stands, if you dismiss your team prior to April 2nd, you will not be required to pay this for them. So a lot of people have said, well, what if I dismiss my team? Can I rehire them? Yes, you can rehire them at any time. Some people said, well, what if I rehire them instead of putting them on a W-2? What if I rehire them as a 1099? What that means to you is that you no longer have the exemption for overtime. So now you have to pay overtime. They're not waived for that overtime. And some states may require you to go back and pay any overtime that employee
may have accrued
yeah, earlier in the year in 2020. Also, a state will notice if there's someone with a social security number that went from a W-2 to a 1099 under the same employer in the same year. So be careful about that. You have to be able to say why you would take them from a W-2 to a 1099 and make sure that it's legit, that you're not doing this to your advantage, but it's to the advantage of the business. Also, it's been asked, can I rehire my team back at another rate? Yes, you can. You can rehire them at any rate you want. It's your choice, but it cannot be less than minimum wage. It may be better if you need to reduce the rate. Maybe you reduce the rate across the board and everybody gets a percentage rate, or you take everybody down to a base rate if that's something that you feel you need to do. Another thing that people have been concerned about is, well, what if I lose my employees? What if they won't come back to me? If you're going to terminate your employees, you may want to say, I'm going to rehire you and I'm going to give you a sign-in bonus when I do. I don't know when that's going to be, when the government lets us come back to the office. I may not be able to hire everybody at the same time, but I want to hire everybody back and I will give you a sign-in bonus to come back to me. And I don't know what that sign-in bonus could be. It could be a small amount. It could be a large amount monthly over the course of 2020. But anything would be better than nothing, just to show your team that you value them and you want them to stick with you.
That's great.
Is there a question?
So there was one question. It was an implementation. So if you were to exercise the termination of your entire team, but you needed to stay open to see emergency patients, so you're working on what we would call a skeleton crew, how could we manage that? What would be a way to handle that?
I'm going to address that because that's a common question, because many of us do need to come in. So if you just hold that, let me get to that. I will address that. So a lot of people have asked, can I use my people's time off as their emergency pay? And again, we don't know, but it's thought that that will not apply. If they have time off, then their time off needs to be given and the emergency pay will be different. But the attorney did suggest that you put together a COVID-19 policy in place according to what your regulations are in your state, and you tell your team members that this is your sick pay, what I'm going to pay you according to the emergency leave, and therefore that regulation has been met. So currently, we do not think that you can use people's accrued time off as a replacement for this emergency leave that the government has told us that will come in place on April 2nd. So the current answer is we don't think so, but we don't know.
Okay.
Next. Other people have asked, if I terminate my people today, do I have to pay their time off that has been accrued? This is a state-by-state basis, so check with your state. Every state is different. Most states don't require you to pay acquired time off, but some states do. That should be determined by your written policy that you have for your office policy. It should state there. But if you don't have a policy, please refer to your state. There are some states that a minimum paid time off is required. So please make sure you're checking with your state regulations because that is so important at this point. If this is confusing to you, again, let me just say for you guys who just tuned in, there are attorneys ready to talk with you. Densmore.com is the attorney that we're working with. There are many out there. I don't have any allegiance to her, to their firm. They are not paying us to say this. They did volunteer their time yesterday to give us this information, and I'm very grateful for that. But they're very knowledgeable, and that's why we're using them.
Yeah, I think just to reiterate what Dr. Bobbi is saying, it's really important if you're outside any state, each individual state has its own unique requirements. And so you really, at a high level, some of this stuff is all going to be the same. We know that the April 2nd date is the same, but for each individual state, you really need to if you're going to get into the nitty gritty, you've got to find some consultants there to help you.
Let's talk about if you do terminate your team, what are your responsibilities as far as your medical benefits and your retirement benefits? Again, this is a state-by-state basis and also an insurance policy basis. So check with your state and check with your insurance on what their policy is, especially for medical insurance. Yes, please. Especially for medical insurance. Some medical insurance will require you to have a COBRA. Some medical insurance will say that if you just lay your people off and don't terminate them, then you could still pay for their benefits. But you do need to check with your medical insurance carrier as to what their policy is for this time of this pandemic. With your retirement plan, when your retirement plan was established, there should have been a written policy. Everybody had that. If you don't know where yours is, please contact your plan administrator. But in your written policy, it states what you need to do if someone gets laid off, if someone gets terminated, and what that means to you. If you terminate your whole team, you may have to end your plan, and that can be costly. So please make sure that if you're going to lay your team off or you're going to terminate them, you know what you have to do for your retirement plan that is in place, because there are required policies that you have to follow to make sure that your team is taken care of, and you do not want to be penalized for not following that.
Just to be clear, normally I can push the buttons quite easily, but in this mode that we're in, there is no mouse on the screen, so it's making it a little challenging. All right, is this the right slide?
That's the right slide.
All right. I'm telling you, there's no mouse on the screen.
Okay, you're forgiven. So here's the answer to your question. If I have an unemployed employee and there's an emergency, what do I need to do? So can you move that over just so I can see?
I can. I have to get out of this mode real quick.
No. Don't worry about it. So unemployment is state by state. Every state gives different unemployment, gives different unemployment rates and have different unemployment policies. And I hate to keep saying it's state by state, but it is. So, and you do need to check with your state. which is why it's so important to have an attorney who understands your state law to tell you everything you need to know, which is, again, what I'm doing tomorrow morning. But typically, an income earned while you're on unemployment will lower the amount of unemployment that you get, but it will not disqualify you from unemployment. Meaning, if I terminate my entire team and I need to bring somebody in to work with me on an emergency and I need to pay them, the amount of money that I pay them will go against what they're getting for unemployment. So they may get less or no unemployment, but it won't disqualify them from getting unemployment next week. Now, you need to make it clear that you are not rehiring them. You are only working them on a case-by-case basis, only at this rate, X amount of money. So make it clear, maybe in a written document, that I need you only on a case-by-case basis. This is not a rehire. It's only for emergency procedures only. Remember, you cannot pay them less than minimum wage, and you cannot pay them under the table. Guys, you will go to jail for tax fraud. If you're not paying payroll taxes for someone who's working for you, that is tax fraud and that is illegal, and you can go to jail for that. So please don't think about paying people under the table. Pay them legally. Just tell them that they are not rehired and you're only using them on a case-by-case basis. Next slide, please. So let's talk about, there's the federal emergency sick leave, and then there's the federal emergency family medical leave. Two different things. So make sure you understand this.
Okay, so just to be clear, what we've been talking about so far was called
the federal emergency medical leave,
which is
that's the sick leave.
The sick leave for the 2 weeks that we may be obligated for each person that works for us.
Correct.
Up to a possible $511 a day.
For 10 days.
And now this is something completely different.
This is something completely different. This is family medical leave. This is if an employee needs to go home to take care of their family, meaning a child who is out of school, out of daycare, or their caregiver cannot take care of them due to the coronavirus. Not because they have the coronavirus, not because their caregiver has the coronavirus. These are schools that are currently closed. If you have an employee who has a child and their school is currently closed and that child is at home, you will be on April 2nd obligated to pay that employee to stay at home with their child if that employee chooses to do that. Now, the employee would have to have worked for you for at least 30 days, and you will only have to pay them 2/3 of their rate, their daily rate, or $200 a day, whichever is less. So, I'm sorry, whichever is more. So $200 a day or 2/3 of their pay. Let me make sure you understand this. This is not for 10 days. This is for 12 weeks. So you're paying them up to $200 a day for 12 weeks to stay at home with their child if they so choose. Now, the first 10 days that they're at home, you do not have to pay them. So the first 10 days that they're at home, they do not qualify for this. It starts after 10 days. So it would not start until April 12th. So what happens between April 2nd and April 12th? You would have to pay them the $511 a day. So this employee who chooses to be at home with their child would qualify for the $511 per day for the first 10 days. And then after that, you would pay them up to $200 per day for 12 weeks.
Yesterday, there was a clever dentist who said, what if I terminate my employees and then hire them right back so they are not on my books for having been with me for 30 days? Rather clever thought, but what was the...
And the answer is, we don't know. We know that the government is trying to take care of our team members, as are we. So we feel like the government would push that down and say you're still liable. But we just don't know. We don't have clear answers yet. Again, that's why this is not going into effect until April 2nd, because they're trying to figure out all the answers for us between now and April 2nd. Next slide or question. So let's talk about how we can take care of our business, because obviously we want to take care of our team members. But if there's no business when this is all over, there's no reason to take care of our team members. We have to take care of our business. And that's why we're even talking about terminating our employees, because what we have to tell them is we have to do what's best for the business today, so we will have a business tomorrow. And if that means terminating you today to rehire you tomorrow, that's what we have to do. Because if we push through and try to keep you on payroll, and then we end up going out of business because we have no cash flow and we've used all our cash flow, then it does us no good at all to do that. So we have to help our team members realize that we're doing what's best for the business today, so you have a job tomorrow. So what does that mean for you guys? Well, one thing that most businesses should have is a line of credit. If you don't have a line of credit, I would strongly encourage you to go get a line of credit today with your bank. There are still banks who are working with us even in this crisis to get a line of credit. How much line of credit? I suggest a line of credit that would keep you alive for at least 3 months. So 3 to 6 months worth of cash is what I feel personally that you need to have for your business. So if your line of credit is not that much, maybe you can ask your bank to increase their line of credit. That's what I did. I went to my bank and I said, I need a higher line of credit and I want to take it out today. I did not leave that line of credit sitting there for me to make it applicable at the time that I need it, because I don't know how bad this crisis is going to get. And if this crisis is going to get really bad and the banks end up having little money, they will not enforce that line of credit. They will shut it down even before you've taken money out. So what I did was I went and I took my line of credit and I activated it. I took that money, I put in my checking account. Now, most of that money in that checking account, I took out of the bank where the line of credit was and put into another bank. Because if there's cash sitting in your checking account at a bank, they do have the right to access that cash to pay down on a loan. So if they call your loan and you have money at that bank, they can take that money. Now, obviously, we all hope that won't happen in this crisis, but this is a crisis and we don't know what's going to happen. So I would strongly encourage you to take a line of credit, take that cash and have it accessible and liquid for you if you need it. You will have to pay interest only on that. I don't care. Pay it. You're going to need this money if and when you need it. So it's so important.
There was a question before we moved into this section on loans. There's a question from the last one on the Family Medical Leave Act. If the employees were terminated prior to the April 2nd, is it still the case that as we think today, we would not be responsible for that?
As we think today, we would not be responsible for that, because if you don't have an employee, you should not be required to have to pay a benefit to that employee. That's as we know it today. A lot can change between now and April 2nd. Okay. Can I continue or you have another question?
No, that's good.
Okay. So I'll go back. So let's talk about small business loans. The SBA has set up small business loans for you to go out and take a small business loan. I was just on with a SBA loan advisor just now on the phone as to what this means for us. The interest rates are really low now. They are looking at people who are in financial distress. Those people will get their loans first, and then other people will get their loans second. I would suggest that you go to your bank and speak with your banker if you feel you need a loan. Bankers are there for you. I will tell you that my banker at Pinnacle Financial reached out to me 2 weeks ago and said, this is starting to get serious. If you need me, I'm here. And I would hope that you all have a relationship with your banker like that. If you do not, walk into your bank, meet your banker face to face, or in this case, maybe a Zoom or FaceTime, and get to know them and tell them what's going on with your business and ask them how they can help you, because currently they are available to help you and they want to help you. Now, there are also existing loans that you may have with your business or personally. What do you do with those? What I would suggest is that you put all loan payments on hold for as long as you can. My banker reached out to me and said, hey, we can put your loan payments on loan, my business loan payments on loan for my business and my building. and you would only have to pay interest only. I reached back out to her and said, I want to pay nothing. I want to pay no principal, no interest, and I don't want any interest accruing during this time for 3 months. And she said, done. So your bank and your loan people are willing to work with you now. You need to put that in line now. I would not wait for things to get worse. I know that you may say, I have money to pay my bills now. We all do, but we don't know what tomorrow will hold, and we don't know what position our bank and loan people will be in to be able to extend things for us later. So I would advise that you put your payments on hold and ask for no interest to be accrued during this time. Same thing with mortgages. Your banks will work with you. They do want to know if you've been terminated or laid off, or if your business is in distress. Be honest with them. Tell them what's happening. If you don't know, you don't know. But we anticipate that this is going to get worse. It's been said that this is going to be a 6 to 8 week shutdown for most dental offices across the United States. And if you have not been shut down yet, as North Carolina has not, you can expect to be. So I would anticipate that 6 to 8 weeks minimum that we're not going to have an income. And what will that mean for you? If you're in a position where you can go out and take care of that, that's fine. But if you're not, start now today and call your bank and call your creditors and let them know that you may be in financial distress and that you may need their help, and have them set that up now. And then you can pay them as you need to pay them. Now, you need to know you're still going to owe the money, obviously. But for now, we just need to keep cash flow handy so we can keep our businesses afloat, because there are going to be bills that we're going to have to pay, and we need to have that cash flow available. So questions, Dr. Rob?
Okay, so can we come out of this?
We can come out of this.
Good, so that I can help answer the questions that have been coming in. So give me 1 second here. So Dr. Bobbi, the first thing.
Let me say this, guys. Someone asked what webinar we're talking about from the attorneys. A lot of what I'm talking about today was addressed on a webinar yesterday that we had with a labor and employment attorney. We had her online for about an hour and a half, and she answered a lot of great questions for us. She's from Dinsmore and Sloan Associates. It's Dinsmore, D-I-N-S-M-O-R-E, Dinsmore.com. That webinar is available on our website, StanleyInstitute.com. You can go out and access that right away, StanleyInstitute.com, and you can watch that entire webinar. I watched it again today because I was still unclear on some answers. There's so much going on right now and so many moving pieces that we need to get as many answers as we can get. I felt like she did a great job yesterday answering our questions and really getting us some answers that we needed.
Okay, so in that vein, someone asked, will today's recording also be available?
Today's recording will also be available, yes. Now, someone's asking me, didn't the federal government put into effect the emergency medical leave last week? No, it will not go in effect until April 2nd. They signed it, the president signed it on March 20th. It does not go into effect until April 2nd. So we have between now and April 2nd to decide how we're going to fund this for our team members if we need to, or if we're going to terminate our team members. And that's a question that you guys really need to deal with, because honestly, I'm sure you guys are like we are. We're struggling between our heart and our mind. Our mind is telling us we need to do what's best for our business, but our heart is telling us to take care of our team members. And so it's a struggle. But again, let me say, if you don't have a business for your team members to come back to, it's not helping your team members right now. So you have to think of this from a business standpoint.
Thank you, Dr. Bobbi. That was good. That was very, very good. The question that's being asked is, if you laid off, if you terminated your entire team, when should those team members apply for unemployment?
And the answer to that is immediately.
Right.
Immediately. They should not wait until April 2nd. If you terminated them today, immediately you should have them apply for unemployment.
And we've also heard that most states have waived the waiting period for unemployment benefits. So if they were to apply immediately, they will actually start to receive payments immediately.
Correct.
This is correct?
Yes, and there's a question that with this situation, is there a difference between temporarily laying off your team and terminating? Again, that is a state-by-state basis. Temporarily laying off your team members is called furlough, and a lot of states will allow you to furlough your employees, which means that they can still get their benefits. You can still pay their medical. They can still get whatever employee benefits that you give while they're laid off. Termination means that they get no benefits. And again, that is a state-by-state law, and you need to talk to an attorney or go to your state website to figure that out.
There was a question, when will we know the details on this April 2nd thing? And that is reflected by the U.S. government.
That it's coming out hourly.
Yeah.
I mean, it is changing hourly. Initially, when they put this law together, they said this was exempted for employers with less than 50 employees. They've come back and said, no, it's for everybody under 500 employees. So daily it is changing, and it is changing rapidly. So if you're going to go to your team and talk to your team, whether you're going to keep them on payroll or you're going to terminate them or lay them off, let them know this is changing daily. And what I'm telling you today may change tomorrow. I may tell you today that I can pay your payroll, and tomorrow I may tell you that I cannot, because it's changing and I have to change with the times.
One thing to add to this that adds another layer of complexity to the entire situation is the fact that the government, when they enacted this law, included all businesses 500 employees or under, and there is some talk that there will be an allowance for businesses 50 employees or smaller would be excluded from this responsibility. The problem that we're faced with is that we're running up to the end of this April 2nd deadline, and we don't know, when I say we, collectively, the business owners, small business owners out there, we don't know when we need to make that decision and whether or not we're going to be excluded from this requirement or not. So we're kind of in the dark on that one. It adds just another level of complexity to the situation in that we might be not even included in it. And
so a question is, what if I reduce my team members' pay rate? What if reduce their hours? Are they still eligible? And the answer to that is yes. On April 2nd, they are still eligible. Now, how are they eligible? We don't know. Obviously, it's telling us that if part-time is at a pro rate, so it's not the whole 511 hours, $511 for a part-time person. But how will they estimate a part-time person? Is it on the last 30 days or yesterday? We don't have that clarification yet because they have not given us that. We'll know more as we get closer because they are putting the rules together every day. It's a moving target, guys. We just don't know. What we do know is that we will be obligated to pay our team members if we're shut down or if they get the coronavirus. We do know that we will be obligated to pay them come April 2nd as it currently stands. But there's still a lot of unanswered questions.
There was a question, what if you simply do the math, $511 for 2 weeks times every employee, it starts to add up pretty quickly. If you don't have those cash reserves sitting readily available to you, and you haven't had the opportunity to open up a line of credit or pull down on loans and all the things that you recommended at the end, what would be your recourse?
Okay, let me say this first. One thing I have not said is all this money that you have to pay out through sick leave and medical will be returned to you. I think that's important to say. So if you have the cash line now to support your team through this, by all means do it. You will get that money back in a tax credit. What that means is that when you go to pay your quarterly taxes, your payroll taxes, I think Social Security and medical, I think you will be reduced according to how much you paid. And if you paid more than what you're owing to the government, they will write you a check. We think currently the way it stands, you will get that check within 3 weeks of that time. Again, this is a moving target. We don't know, but we do know that every dollar of that will come back to you in the future. Now, what if you don't have the cash to pay that? the government has said, too bad, go get a loan. Literally, that's what they've said. Too bad, go get a loan. This is your responsibility and your obligation because you are an employer and it's your obligation. The government has told you, you have to pay this. So you can't say, well, I don't have the money. They're saying, then go borrow it because you owe it.
So a good line of thinking is to reduce your staff down to a skeleton crew. How do we do that in staying within the law? How do we reduce it down to your assistant who may be able to do chairside as well as answer the calls and do the billing, your super person, and yourself, in order to keep some cash coming in on these emergency patients, helping the society at the same time? How do we do that?
That's a great question. So first of all, we have to be careful of discrimination laws. And obviously this is new charted territory. So discrimination laws are going to be taken into account, but not as much as they would in a normal situation. The first thing I would do is say, I would sit my team members down and I would say, guys, I need to put some of you guys, I need to put some of you guys on unemployment. Anybody want to volunteer? You may have team members who say, I'll take it. I'll go on unemployment. I'll go home. That's the first thing. The next thing is last hired, first fired. That's legit. So I had a doctor yesterday say, I have a girl who's been with me for 4 months. She's pregnant. If I fire her, am I going to get in trouble for her because she's pregnant? She was the last hired, first fired. That's legit. Then the next thing I would do is go down to non-essential workers. Is it essential for you to keep your sterilization girl? Is it essential for you to keep your bookkeeper? You have to determine what is essential for you to keep your business afloat. And then once you get down to your essential team members, then you start to talk about, okay, from these guys, who's my skeleton crew? That is a logistic way to approach it from an attorney's point of view and also from my point of view. She stated that verbatim yesterday. Okay, next question.
The next question is coming. So if there's an associate dentist whose salary is based on a percentage of production, how is the rate of regular pay calculated?
So there are two different things you're asking me here, for unemployment and for the medical leave. It doesn't matter how much you got paid as an associate, your unemployment is going to be your unemployment. In North Carolina, unemployment is $300 and some odd per week, a week. And I don't care how much money you made, that's how much money you're getting. With the federal medical leave and the federal sick leave, federal medical family leave and the sick leave, the rate is the rate. It doesn't matter how much you made. But again, employers can choose to exempt associates from that. So associates, if you're there on April 2nd and you decide that you need to go home because of symptoms, or your office gets shut down because of the coronavirus, you may be exempt and you may get nothing. And it is the way it is. I'm sorry. And that's true for honor doctors too. Honor doctors don't qualify either.
So one of the things that, there's so many moving parts. We've gone over a lot of moving parts today in this presentation. One of the things that really I feel like would work really well for a lot of folks is that you have to rely on your character. You have to fall back on being a good person. And as we go through these, there's so many little nuances and this, that, and the other, and we're trying to make it all work. But at the end of the day, if you run it past yourself in terms of, is this the right thing to do for the business? Is the right thing to do for my team members? Is it the right thing to do for society and our patients? If you ask that question and you feel confident that you're making the decision that's in the best interest of all of those people, you're not going to be wrong. You're not going to be wrong. So that's how we're running it behind the scenes. There's a lot of uncertainty, but at the end of the day, we're good people. We wouldn't be in this industry if we weren't good people. Right. And so rely on your heart. Rely on your heart and make really good decisions based on being a good person. and it will all work out in the end. We're all going to get through this. It's going to be a little choppy, but we're all going to get through this in the end.
So another question was, if I work on a 4-day work week, am I required to pay the medical leave based on the 80 hours, 10 days? And yes, you are. Doesn't matter if a person works 1 day a week, how much they work, it's based on the 80 hours in 10 days a week. So if they're a full-time employee, it's based on 80 hours, 10 days a week. So to answer that a little bit more clearer, if they work 34 hours, then that comes out to 68 hours. Is it 68 hours or 80 hours? At the moment, we think it's 68 hours, not 80 hours, but we don't know. We think that it may even go up to 80 hours.
A good question just came in. So, and one that every one of us needs to understand and kind of have an idea in place. We're running on a skeleton crew, and someone on the team becomes sick. One of the members becomes sick or exposed. What do we do? So we got some good information from our CRNAs that we work closely with at the hospital. The hospital is not shutting down. So if one of the doctors becomes sick in the hospital, they're not shutting the entire hospital down. So we're kind of using this as a guideline for our practice. So if we have a skeleton crew of 3 people, a doctor and two other people, and they're working, and one of those persons, hopefully not the doctor, becomes sick or is self-quarantined, our approach for now is to replace that person. So is to put somebody else in that spot and not shut the entire office down. Remember, we're doing emergency services. If we're not, as healthcare providers, available to do emergency services, those people are going to go to the hospital. That is the last place that we need these people showing up. Because if they're not sick now and they show up at the hospital and they're around a bunch of other people that have the virus, that's not good for society. And we all know that most hospitals aren't even equipped to handle dental emergencies. So we've got to be able to maintain a certain level of service to the industry, to our patient pool, to handle emergencies, true emergencies. So we've got to stay open.
We also have to worry about if a patient comes in and then later tomorrow, the next day, they find out that they have the virus. One of the things that we're implementing in our office is we will see emergency patients, but we only see 1 patient per room per day. So we have 11 rooms. We can only see 11 patients per day. And we will not use that room again for another 24 hours because we want to give time for the virus. As much as we sterilize and do everything, all our wipe downs and our spraying, we still want to give that room 24 hours if we can. So I think that's a good thing to implement. Someone asked if the government shuts us down what's the criteria for emergency sick leave? If the government shuts us down, does the person do they have to be sick and the government shut us down? Do they have to be sick or the government shut us down? So currently the way it's said is we believe that if the government shuts us down, that is a criteria, we believe. We know that if they get sick or a family member gets sick, that is also a criteria. So we believe that all the above qualifies for the sick leave.
There's a good question about liability. So we're working around these liability issues. And the first thing we want to say is, and we said it a couple of times, you need to find a counselor in your state that can really help you navigate the very fine details and specifics of this. At a high level, with regards to if you fire your team, would I be, in order to avoid the Federal Emergency Act, you're not firing the team because you're trying to avoid the act. You're firing the team because you don't have the money in the bank to pay what the government's asking you to pay. And that would be a hardship on the business. So it would put the business in bankruptcy. So there's some stipulations that will become more clear in the next couple of days. But if that's the case, you would not be held liable in any way or form if the act of doing what they're asking is going to put you into bankruptcy. So they can't put you into bankruptcy and then you be held accountable for letting your team go.
So another question is, if an associate is a 1099 through an S Corp and they're paid on collections, what should we do for or with that associate? So our associate is a W-2 employee. He will not qualify for the medical leave because we will ask for him to be exempt. for that reason, because he's a high income producer. So we have the government has given us the privilege to exempt him, so we will do that. But we also, he is based on collections, and his income is based on collections. His unemployment will be minimal to none compared to his income, and we realize that he has student loans and he has other bills, and we love our associate. So what we're doing for our associate is we're allowing him to be able to come in and see our emergencies, and therefore he can gain a little bit of income during this time. So we've asked him if he wants to come in and see emergencies, and therefore he can gain some money, and anything that he gets from those collections, obviously that percentage will go to him. And that's the best we can do, and he's very grateful for that.
The follow-up question to that is, Dr. Stanley, are hygienists considered high-income earners?
So that's a great question. You cannot exempt your hygienists from this. They are not considered high-income earners. High-income earners, again, are anybody who's licensed through the state. That will be doctors, your associates, CRNAs, physician's assistants, high nurse practitioners, people of that nature who are licensed, not nurses, not hygienists. And let's just look for another question here. I know you guys are asking a lot of questions. We're trying to keep up, and I keep seeing the little pop-up that says someone's raised their hand, but it doesn't give us guidance on how you raise your hand. There's a question: how do you calculate an employee on salary? How do you calculate an employee on salary? I'm not quite sure. If you can elaborate a little bit more on what you meant by that question, I'll be able to answer.
So there was a question. If I have 50 or less employees, am I currently obligated to pay the $511, up to a $511 per day for 2 weeks?
Today, yes. We don't know if that law is going to change, but the government has said you are required. Anybody 500 or less employees, no matter how much less, 500 and under employees are required to pay for the federal sick leave and the federal medical family leave. So you are required to pay that.
So that was what we had mentioned earlier. There is rumor that seems to be putting small businesses 50 or under at an extreme burden that would not be something that they could normally handle. So we're expecting some sort of maybe allowance for people 50 or under, or some number or under, to be exempt. But the problem is, as we go through this day by day, we don't know if that answer is going to come in time before that April 2nd deadline. And
so another question is, can the owner, doctor, W-2 qualify for the family medical leave? I'm uncertain if I'm giving you the correct answer, so please follow up on this, but currently I do not believe so. I am uncertain on that, so please follow up with that. So again, guys, you have a couple of different options. I'll let you go through that to look for the rest of the questions. You have a couple of different options at this point. If you don't want to pay, or you cannot pay this family medical leave or this emergency sick leave that you have that's coming up, you do have the option to terminate your team before April 2nd, and we do think you'll be okay. There is a question for me to confirm that $511 is the maximum amount, not a fixed amount per day per employee. It is a maximum amount per employee that is prorated based on the hours that they work, whether they're full-time or part-time. But yes, it is $511 per day maximum, up to 10 days that you will be required to pay an employee, which is 80 hours. So again, that's the information they've given us. They haven't clarified how that works with our employees and true answers with that. So we just don't know at this point, but that is what we're being told. So again, you can, if you want to keep your employees employed, I applaud you for that. I think that's wonderful if you have the ability to do that. This law is in effect from April 2nd to December 31st. So if you feel that you can pay your team members to keep them on staff, and you can pay this at any time between April 2nd and December 31st, great. Once they reach their 10 days for sick leave, and once they reach their 12 weeks for family medical leave, That's all they get currently. We don't know if the government is going to extend that. That is changing daily. It can change after April 2nd. We don't know what that means. So whatever you're promising your team members, please be careful and make sure that you're financially able to support them in this, and that it's going to be okay. Because what we don't want is, we don't want our team members to be angry with us because we made promises that we cannot guarantee. We do want to take care of them, but we just don't know. The climate is changing so quickly with this.
We have a question. If there's an employee who's currently out on maternity leave, and they're not expected to be back in time, are they eligible for the April 2nd?
I cannot answer that. I don't know. My thought process is I don't know. I can't answer that. I want to answer it legitimately and say no, but I don't know. And I would ask that you speak to a labor and employment attorney to find out the answers. Guys, just so you know, I think the rate for an attorney is about around $500 an hour for them to speak with you and answer your answers. That's good money spent. I mean, go out and spend $500, have a list of questions, ask them the questions so you make sure that you are covered and you are doing the right thing by your employees, whether you're keeping them employed or you're laying them off or you're terminating them. You want to be able to follow all the laws in your state, and each state has different laws. So, if you need an attorney, go to densmore.com, ask for an attorney who understands your state law, and get on the phone with them and get answers. I have been researching this for days now. I've been on multiple webinars. I feel like I have the answers, and I'm still hiring an attorney because I want my team members to be taken care of, and I want to make sure that I'm covered legally, and I want to make sure my business is covered legally.
Recently, I received an email from the AGD and I think another one from the ADA. They're lobbying on our behalf as small business owners, and they're asking the legislative body to make sure that they have hardship provisions in place in this $1 trillion aid package that they're working on. If you have not clicked on the button in order to submit your support of this endeavor, it should be in your email, in your inbox. All you have to do is click on it, and it will actually draft the letter for you, and then you hit send. So it's super, super easy. But if you haven't done that, I really encourage you to do that.
You can find that on the ADA website, the AGD website, your local dental website, because everybody's pushing for this because we're all in this together. I do have a question about something I need to clarify because I did misspeak. For the family medical leave, it's $200 a day or 2/3 of their income, whichever is less, not whichever is greater. So they can't make more money on this leave than what they would normally get in the office. So it's 2/3 of their income or $200, whichever is less.
And there was a question, if we were to lay off our team members before the April 2nd deadline, would we be leaving them high and dry because they would then be no longer a candidate for these aids? Where would they go for help?
So if you terminate your team members, what you need to do is tell them immediately to go and apply for unemployment. I've told you unemployment in North Carolina is pennies. However, guys, the same way I asked you to go to your mortgage broker, to go to your loan officers, to go to your bank and ask for a waiver in loan payments for the next couple months, it's the same thing that you need to be telling your team members. I mean, if they don't have to pay their mortgage for 2 months, if they don't have to pay a car payment for 2 months, then they don't need a lot of money to survive. And I totally understand that we want to take care of our team members. We've reached out to our team members and said, if you need anything, see me. I will personally pull out my wallet and give you the cash from my wallet if you need it, because I want to take care of my team member. I will not pay myself to be able to pay my team member. I want to take care of them. But on the other hand, I have 25 employees. Can I pay 25 employees $5,000? I don't know if I can do that. And I need to sit back and say, is this something that makes sense for me business-wise, or does it make sense for all of us to take a breather until we know what's going to happen and then come back and work full-fledged and everybody be able to get their job back? And so we have to be realistic. Is it more important for your employee to get $5,000 now, or is it more important for them to have a job later? That's the question we need to be asking each other. And in my book, it's more important to have a job later, because I don't think jobs are going to be so great when this economy gets back up and running, because things are going to start out slow and people are going to be hit hard, and it's going to be hard to hire new people. And so I think your employee would rather be on unemployment for a short amount of time now and know they have a job later than to know that they may not have a job for the rest of the year and have to draw unemployment for the rest of the year. So as much as it seems like we're not helping our employees by doing this, we're actually helping them. We're guaranteeing them a job later. And we need to make sure that they understand that. So somebody said, if I owe my associate a large sum of money, how should I manage? If you owe your associate a large sum of money, it's just like payroll. I paid payroll today, and it was several thousands of dollars, and it was a large sum. And I had to pay it because I owed it to my team members. If you owe your associate, you have to pay it. That's where the line of credit comes in handy, and that's where a small business loan comes in handy. You're legal if you owe it, you have to pay it. There's no question about it. You can't say I don't have the money, because they will take you to court and you'll lose. So get a line of credit for your business. Your banker is more than willing to work with you on that, and pay the bills that you owe. Pay the bills that you owe. Guys, pay your labs. Listen to me. Pay your labs. They have to eat too. And I know you think that you need to hoard your money for you. It's important that you have money, but our labs need us now. You need to pay them. Pay your suppliers. If you feel like you can't pay your supplier, you call them and ask them what arrangements you can work out. But please, for God's sake, pay your labs. They are small business owners too, just like you. And it's just as if your patient called you and said, I don't want to pay you for the service that you offered. If they offered you a service, pay them.
Question, if you have already shut your office down, you closed it earlier, a few days ago, would your team be eligible for the Emergency Medical Leave Act?
So your team is not eligible for this act until April 2nd. If you still have them on payroll, if you still have them as employees and you've chose not to pay them while they're down, but you have not terminated them, or in some states allow you to lay them off or furlough them, you are responsible. For instance, currently, none of our team members are fired. They are all unpaid because we are not open, and we're only seeing a couple of emergencies. So only a couple of them are coming in and getting paid as we are using them. Come April 2nd, if they are still at home and not able to work, I do have to pay them. We have to pay them. So if you have not terminated your team come April 2nd, or worked out some type of arrangements to lay them off according to your state law, you are responsible to pay them for the medical leave. So make sure that you don't just have team members who are not working, because they are still employed.
Mm-hmm. The question, and I believe you mentioned this earlier, if you terminate your team and then subsequently want to hire them back, can you hire them back at a different rate?
Yes, you may hire them back at a different rate. Make sure that you're abiding by all discrimination laws, but you may hire them back at any rate that you want, as long as it's above minimum wage. If you feel uncomfortable with this, a good way may be to just across the board say everybody's coming back at 10% less, or everybody's coming back at a base rate. But you are allowed to rehire at any rate that you would like to rehire.
Another question, if I have credit card debt, what should I do? Should I pay that credit card debt down, or should I pay the minimum amount, or should I call them?
So I would recommend that you call them. Some credit cards are allowing you to pass on payments. More importantly, they're allowing you to not pay the full amount and waive late fees. We do use credit cards, and I'm a big believer in paying those off monthly. However, with the current state of the economy and being unclear where we are, if your cash flow is not where you think it should be, call your company and see if you can get a waiver for 1 or 2 months to pay the minimum amount, or reduce your interest rate so that you pay the minimum amount. Because guys, cash flow is king right now. That's what we're talking about. Keep your cash flow handy, because we don't know how long this is going to last, and we don't know where the next income is going to come from. So definitely keep your cash flow handy. Ask for rate reductions. Now, somebody has asked, if I want to terminate my team and my office has been closed, so we're not going to have a face-to-face, what's the best way to terminate your team? I believe it's a very personal conversation that you need to have with your team members. I have many colleagues who have sent out a across-the-board email to their team members and then called them individually. I would not do that. I would call them individually to start with. I would let them know that I'm calling everybody, and I do not want them to speak to anybody before I speak to them. And that's very important. And that policy is part of my policy for rehiring. If I find out that you spoke with someone before I spoke with them, then I will not rehire you. But if this is something that we plan to do, we will call or FaceTime an employee and speak with them and let them understand what's going on, and give them the ability to ask questions, because a lot can be misinterpreted in a text or an email, and you need to give them the opportunity to understand that you're doing this for them. This is not a permanent thing, and that they will have the ability to be rehired. And also let them know if there's a rehiring bonus that you plan to put in place, which I would encourage everybody to do, to give them a reason to want to come back to work for you.
Is there a way to use paid time off, accrued paid time off, as a rehiring sign-in bonus?
So yes, absolutely. If you want to tell them that their re-signing bonus is an extra week of vacation, by all means you can. What I would not do is say, I'm going to rehire you, and I know between now and the end of the year you get 2 weeks paid vacation, so I'm going to go ahead and pay you that now to rehire you, and you don't get it later. I would not try to cheat any of my employees out of any of their earned paid time off. But if you want to give them additional paid time off as a bonus, that's a wonderful thing. I know in today's society, more people are about time and experiences than money. So it may be that that's more important to them.
All right, so here's the question we answered earlier. If I fire my team, you doctors are so clever. If I fire my team and then rehire my team, does that restart the waiting period? And in this case, more specifically with respect to benefits like 401, profit sharing.
So for the benefits, it's state by state, and you need to figure out what's important for your state, what the regulations are for your state. So I cannot answer that question. If you fired your team today and rehired them after April 2nd, would you still be responsible for this law? Yes. This law is in effect from April 2nd to December 31st. So anytime in that time period, no matter when a person is hired for the sick leave, they can go out on sick leave. For the family medical leave, I believe that they have to have been employed for 30 days previous. But again, check with that before you take that as law. Guys, Dr. Rob and I are dentists. We've done a lot of research and gotten a lot of answers, and we want to share this with you, but we want you to understand we are not attorneys. We are not financial advisors. So please do not take our word as the last word. We're giving you things for you to think about and ponder on, and go out and get the answers that you really need. So please hire an attorney or go out and research your state laws on the website so that you know what you're obligated to do.
And that's a nice lead into what we wanted to do in our next session. Is we wanted to bring on a financial expert. This financial expert will answer the following kinds of questions. Should I liquidate my account? Should I short the market? Should I go long on the market? What should I do with my 401, my profit sharing, and those kinds of things? We feel like that is the next thing that everyone needs to have answers to. So what we're going to do is we're going to work out the logistics behind that. And we'll send out an email to everyone. I hope you're all subscribed. When you get that email, sign up, and that'll be within the next day or two.
And let me answer one last question for Scott. Is it better to terminate or furlough an employee? Again, that is a state-by-state question, and it depends on the state that you're in and the regulations for your state. So Scott, check with your state and see if you furlough them, you can continue to pay their benefits like their medical. If you terminate them, then you have to abide by the medical insurance policy, which may be a COBRA policy or terminating their benefits as a whole. So please check with your state, check with your written regulations for your retirement and your medical insurance as to if you should furlough them or terminate them. Guys, I hope this helped. I hope we gave you some guidance. Obviously, you can reach out to Dr. Rob and I individually. We would love to give you guidance if you want it. My email is drbobbi, B-O-B-B-I, D-R-B-O-B-B-I @stanleyinstitute.com. His is Dr. Robert @stanleyinstitute.com. I'm going to tell you, if you email him, you probably won't get an answer right away. If you email me, you might get an answer in minutes because I am on top of my email. So again, my email is drbobbi, D-R-B-O-B-B-I @stanleyinstitute.com. So if you have any questions that we did not answer or we did not see, reach out to me. I'll try to answer them the best I can. I am going to be on a call tomorrow morning about North Carolina law. So if you have something specific about North Carolina law, my call is at 8 a.m. So by 9 a.m., I should have some answers for you. If you would like to have any answers about that, I'm happy to talk with you over the phone or email. So hope this helped you guys. Please, at any time now or in the future, we can help you. We would love to help you. We're all in this together. We're here for our team members. We want our team members to be successful. We want us to be successful, and we want to get through this thing healthy and alive. So we'll see you guys at our next one.
Bye, guys.